Say you and your family notice a change in you lately. You're not sleeping well, you have tremors, pain, and stiffness. Many doctors may conclude that you have Parkinson's disease, but in reality, that's not the case at all. You may have never considered what you would do if you became very ill and the doctors couldn't find the reason, or the treatment for your diagnosis isn't helping you at all. But that's a problem I faced a few years ago, and many others have a similar problem. Many people don't know what Lyme disease is, or some may have never even heard of it. So I'm going to explain a little bit about how you can get the disease, its side effects, and different treatments. There are many ways that you could possibly come in contact and get Lyme disease. The first and the most common way is to get bitten by a tick, thus infecting you with a bacteria called Burgdorfia. The second way people, and more likely babies, may get Lyme disease is through their mother, by birth, if their mother has Lyme disease and doesn't know it. The third way many people get Lyme disease is through blood work, such as blood transfusion, also coming from people that don't know that they have Lyme disease and giving blood. Is Lyme disease in Iowa? The question is answered very in-depth at iowalymedisease.com. They say yes. Up to recently, the black-legged tick, formerly called the deer tick, which is shown here, in comparison with a dime, is this size. So you can see it's very tiny, and it's very hard to spot on your skin. Until recently, this was the only vector of Lyme disease. Research in the last 4 years has proven that the Lone Star tick and the American dog tick can also harbor the Borrelia bacteria. In fact, the Lone Star tick transmits master disease nearly identical to Lyme disease symptoms. Scientists have not proven the dog tick can transmit the disease to humans yet. Research is currently underway to find an answer. Now that you know how you can become infected with the disease, I will tell you things you may start to notice after you have become infected. Symptoms of Lyme disease can mimic many other diseases and syndromes, or even the common cold and flu. The most common is the rash, which is pictured here. With a wide variety of rashes, it's no wonder that individuals seek out knowledge on various skin rashes that they are inflicted with. The bullseye rash is no exception, sometimes referred to as a target because it looks like a target with a circle in the center. It has various causes and descriptions. Generally, all these types of rashes have an outer ring and then the center clears to show normal skin color. When I was trying to find out if I was in fact affected by Lyme disease, I had gone to a meeting about it. When I got there, I had informed them of my situation. Many of the people there were affected by it or family had been affected by it. They handed me a paper with all of these symptoms, totaling 83 different side effects. I began to mark the ones that I had been noticing. Finally, when I was done, I counted how many I had marked. The symptoms I had marked totaled around 75. According to expressnet.com, some common side effects are tremor, joint pain, changes in cognitive function, swollen glands, confusion or forgetfulness, and mood swings. There are, however, two stages of Lyme disease, acute stage and chronic Lyme, also known as late-stage Lyme disease. Now that you know the different signs and symptoms of Lyme disease, we can now discuss the diagnosing and the treating. There are many ways to treat it once you are diagnosed. The different ways for testing it, the CDC believes that the right test for Lyme disease is the IDSA. There is currently a large controversy over this because the commonly used in correctly diagnosing is the ILADS. Since there is currently no definite test for Lyme disease, laboratory results should not be used to exclude an individual from treatment. Lyme disease is a clinical diagnosis, and tests should be used to support rather than supersede the physician's judgment. The early use of antibiotics can be persistent, recurrent, and refractory Lyme disease. The duration of therapy should be guided by the clinical response rather than the arbitrary, which would be 30 days. The most common method for preventing chronic Lyme is recognition of early manifestation of the disease. There are, however, two stages of Lyme disease, which are acute and chronic. The chronic is when you don't find the disease early enough, so it manifests and multiple times it will give you co-infections. According to WebMD, antibiotics are all around the most prevalent treatment for Lyme. Antibiotics such as doxycycline and amoxicillin taken orally can speed healing of the rash and can usually prevent subsequent symptoms such as arthritis and neurological problems if Lyme is caught early on. Intravenous antibiotics, which are shown here, and usually with Lyme disease they use pumps with syringes. They fill the syringe with the antibiotic and then they put it on a pump with a timer and it slowly pumps it into the tube, which is usually fed into your body. The problem with this is they don't let you do a lot of activities with it, such as swimming. For patients which have co-infections like me, you must treat those co-infections specifically. In my case, I developed POTS syndrome with my Lyme disease, which is a heart condition. We then treated it with a heart medication and a steroid. Now that you have learned a little bit about every aspect of Lyme disease, from how you can get it, the disease to its side effects, the different treatments. This disease, much like others, can affect each person in different ways. Also said at WebMD, the disease can strike more than once in the same individual if he or she is bitten by another tick or reinfected with the Lyme disease bacterium. So always be careful and check for ticks or apply the insect repellent that contains DEET.